your doctor, does it keeps giving you the same diagnosis, but then when you go to another hospital, then the hospital now tells you what exactly the problem is. Why is it sometimes like that with hospitals?
Well, yeah, so this is called, it's patients' rights. We are allowed actually to have as many opinions as possible, so long as we are not delaying care. So if the parents feels that this doctor is not doing a good job, it is okay to go to another healthcare provider to give another opinion about the condition and manage adequately. What I know is that sometimes these coughs can be really frustrating, and we tend to get from one hospital to another, to another, to another, and by the time we get to the last doctor, the symptoms are actually on the way to go. Then we say that is the one who treated it. But I know it can really be very, it can really take a long time, and it can be frustrating.
Okay.
Yeah.
All right. Thank you so much, Sheila. You can call in once again if you have another question for Daktari here, if you feel like she didn't give you an answer that you wanted.
Okay.
But before Sheila called, you're telling us about the difference between upper and lower, respiratory tract infections. You talked about the upper respiratory tract infection. How about the lower one?
Okay, so the lower ones, usually we call that for any infections below the vocal cord. So the bronchus, the bronchitis, pneumonia, bronchiolitis, those are lower respiratory tract infections. They are in the lower airways, which are usually more narrower, and they are also involved in gaseous exchange lower down. So there's a lot of gaseous exchange problems if there's severe infections affecting the lower airways. So that's like a pneumonia. So those are usually the major examples. A lot of them can be due to bacteria and viruses also. But pneumonias, in our setup, our guidelines, children who have pneumonia, we tend to put on antibiotics because looking for the pathogen can be very difficult. So cough, fever, fast breathing, a lot of our guidelines say we can start amoxicillin or the antibiotic that is close to us.
So can an untreated upper infection evolve into a lower, tract infection?
Yes, it can. It can, because we have something we call the united airway. The epithelial lining the upper airways goes all the way sometimes to the lower airways, and the infection struck down, and they can actually precede the other. So we can have a viral upper respiratory tract infection, the flu, then later proceeds to a lower respiratory tract infection. Yeah.
Talk to us about some of the red flags or signs that you see a lot of parents ignore when the child is presenting these symptoms until it's too late. Then they bring that child to the hospital. What are these red flags?
Yes, so the danger signs we always recommend, we look for is a baby who is not able to feed. That is a danger sign. So inability to feed, you're giving the baby food or breastfeeding and the baby doesn't want, that is not a good sign to stay at home. Usually we recommend you come to the hospital. The baby needs help to maintain hydration and glucose levels. Also, if a baby is breathing very, very fast, younger children, if the rate is going above 60 to 70, that's very fast. And if the bigger children, it's going to 30 to 40 breaths per minute, that's also fast. We say we should come to the hospital to get assessed. Also, breathing with a lot of effort, so increased work of breathing, or making loud noises called grunting. Very, very dangerous. It means the child is struggling. She might actually be needing oxygen support. So those are danger signs. We say you need to come to the hospital, or turning blue in the mouth or the hands. It means the body is not getting enough oxygen, because the breathing system is supposed to help to bring oxygen into the body and remove carbon dioxide. So once the infections or asthma is affecting that delivery of oxygen or removing carbon dioxide, then it becomes a very, very big problem, and we need assistance in the hospital. We usually can give extra oxygen support or support with the breathing. Yes.
When you're talking about support, with the breathing, you mentioned something about a spirometer.
Yes.
Then how different is it, from just the normal inhalers that we are used to? What does a spirometer do? And that, an inhaler